particularly happy to be announcing today the IFC investment into Apollo 50 crores as an equity investment towards growth and expansion of this division. And the important thing is for all of us to really look at why this growth in this space. I think over the last 30 years, Apollo has played a significant role in revolutionizing tertiary care in this country. It is now important for us to look at the entire gamut of primary care. How can we be more accessible to individuals? How can we be closer to patients? And how can we help pick up symptoms and problem at an early stage and focus on prevention and keeping people healthy? Also, how do we appreciate the changing needs and aspirations of the community, where a mother having a delivery does not want to have a delivery in a crowded nursing home and probably wait in a waiting room next to an individual who has malaria or typhoid. They're looking for specialized environments, and Cradle does that. In simple surgeries or day surgeries, people are looking for faster turnaround, zero infection, because every case going in is an elective case and there are no infected patients around. So these are specialized formats born out of public need and with the concept or the commitment that we will have additional quality. It is clearly in response to this demand that we created these formats, we incubated these formats, we ensured that we understood, we fine-tuned, we perfected the model, we ensured that we knew the profitability runway of each of these formats, and now this investment which is coming in is for scale. This scale will come in growing each of these, and this is born out of a very simple and very strong ideology that healthcare is moving from the large hospital to the clinic, and from the clinic to the home, and from the home to a ubiquitous 24/7 access on your mobile phone using devices. Apollo has always been at the forefront of bringing in positive innovations which benefit the individual and the customer, which improve quality and bring down costs. All the formats that we're working with at AHLL pursue this very same journey of higher quality, more convenience for the individual, and bringing down costs. It's very clear that across Apollo we want to create and deliver a seamless continuum of care, from primary care to checkups to prevention to simpler ailments which can be easily tackled, and then the high end, whether it's a liver transplant or a major treatment. And these formats of AHLL perfectly complement the large footprint that we have in the tertiary and the quaternary hospitals. Now that the case or the need for the country is very clearly established, I want to reiterate something that we have said very often, and that is the growing disease burden in the realm of non-communicable disease. NCDs, it's estimated by WHO, by Bain, by McKinsey, but the overall is that there will be a cumulative burden by the year 2030 of approximately $6 billion, including cost of treatment as well as loss of productive man days in India alone because of NCDs. It is extremely important for us to not only create the infrastructure to treat patients, but also find these problems early, educate people, and reduce the incidence and the burden of disease. We as a group are extremely committed to fighting this war against NCDs. And here also, AHLL with its multiple formats and the preventive health checkup capabilities will play a very important role in this. Finally, to really talk about why we selected IFC as a partner. I think it was quite easy. It has often been said that there is a dearth of healthcare facilities, and there's also a dearth of good healthcare scripts with the size and the format. So as would be expected, we had a considerable interest when we went into the market to raise funds. However, we particularly worked with IFC on an exclusive basis after the initial bids when they showed interest, because we believe IFC is a partner who has a similar ideology and a commitment. Healthcare is a long-term play. Healthcare is about doing social good as well as making financial returns. IFC understands these two things and have lived out this in many, many geographies. Additionally, we've had a very good working relationship with IFC in 2 or 3 other occasions, and therefore they were a known partner that we're very happy to work with. Besides the fact that we share a global vision, we share a vision and a relationship, they also have a very large global footprint. So many of the formats which are created in India today are potentially scalable internationally. It's not something we will do tomorrow. However, we have the potential to work with our partner. With these, broad overview, I want to thank all of you for being here and really state that what we are doing is the next step or the next phase in the exciting journey of bringing healthcare closer to people. Thank you.